We are back. This is Radio Entrepreneurs. My name is Jeffrey Davis. I'm having a great time today. They have loaded this building with entrepreneurs. They were lining up outside the studio. This is my last one for the day. I have to admit it. Let's see if I can get the names right. Give me a second. The next two entrepreneurs, Dave Shivang, sorry, I altered it, and Nick Durr of PlenOptika, right?
That's right.
Hey guys, welcome.
Thank you.
Thanks for having us.
So what is PlenOptika? I mean, the name doesn't give it away.
So PlenOptika is we're a startup company in Boston. We've been developing a technology for 4 or 5 years and working as a company for about 6 months, making a device that prescribes eyeglasses at the push of a button.
Wow. Does that mean it does my eye test at the push of a button?
It won't do a comprehensive eye exam, but it will tell you what eyeglasses you need.
So I look into the machine?
Mm-hmm.
Yeah. It's right now it looks like a pair of binoculars. You look through the device, and it measures your eye for a few seconds, and then spits out a prescription. It tells you what eyeglasses you need.
Wow. Is that a first?
It's a new way of doing it. There are devices. There's machines that optometrists use to automatically measure eyeglass prescriptions. They're called autorefractors.
Yeah, you guys aren't wearing glasses. I just want to listen to you.
Yeah.
Ironically,
I'm wearing glasses.
none of the co-founders need vision correction. Ironically.
Funny guys. Okay.
There are these devices on the market that are big dishwasher-sized machines, kind of slow, very expensive, that optometrists use, and they haven't changed much in the last decade or two. So we are right now. There's 4 co-founders in the company, and we are all from an engineering background, but different engineering specialties. So we come
Such
from
as?
optical engineering,
Yeah.
electrical engineering, biomedical engineering.
Did you go straight into business out of school, or did you guys do other things first?
We started business.
Did you all like meet at MIT in a dorm or something?
Exactly. We met at MIT. So the 4 of us.
See, I didn't read the
started
notes.
this-
They just pulled them out. If it walks like a duck and it talks like a duck, it's a duck. I mean, you didn't come out
It's
of.
written on our faces. Huh?
Well, you didn't come out of Bentley. Or Babson.
Yeah.
Clearly, you're the MIT model.
Yeah.
Mhm.
Right.
Yeah, so all 4 of us, we met at MIT through this postdoctoral fellowship called the M Plus Vision Fellowship. All of us did PhDs in different disciplines, and then started at MIT in 2011 in a program focused on medical imaging, developing new medical imaging technologies. So that's how it all started.
But straight from the doctoral program into your own business, or do any of you
And
have
it was
business experience?
I have a couple business certificates. So when I was in grad school, I started getting into entrepreneurship, and I was in Seattle, and there's a very strong entrepreneurial community there. So I started taking classes in the school, doing business plan competitions then. So I've been around the space for about 10 years now.
Right. Is the company self-funded from the 4 of you, or did you go out for third-party funding?
We have some third-party government non-dilutive support. So we have some
support.
seed funding. Yeah.
Because it's looked at as public interest for the government?
Yeah, so it's the motivation for this project was originally to address the burden of uncorrected refractive errors, these people that need eyeglasses in low resource settings. So we started this project because we learned about these hundreds of millions of people in India and China, around the low resource world, that don't have the eyeglasses they need.
It's like me, I need eyeglasses for low intellectual settings. So what are you going to do with the business?
We are starting to develop a product for India. So we're working, and our funding actually comes from from the U.S. and from India to develop a product with partners in India for the Indian markets.
Well, such a dense population. Is that why you're thinking of India?
Yeah, I mean,
Bringing it
there's
to the
lots of
masses?
reasons.
Yeah,
There's a dense population. It's an emerging economy, so people can afford eyeglasses. But
Over
there's
200 million middle class.
Mhm.
yeah,
in the United
exactly.
States.
Yeah.
Uh-huh.
But 800 million that are in poverty.
Mm-hmm. So even the people in poverty, they can afford a pair of eyeglasses there. Not all of them, but a large fraction of them. You can buy a pair of high-quality prescription eyeglasses for just a few dollars in India right now.
Really?
Yeah.
It almost pays for the trip.
Yeah, medical tourism. Right?
Just go
Yeah.
and do that. Well, India's a big medical center, isn't it?
It is.
Yeah,
Yeah.
yeah.
Yeah, they have world-class medical care, and this dense population of low and emerging middle-income people.
So what, you develop the product here and you manufacture it there?
Exactly,
I
yeah,
assume there's a
we're-
manufacturing component
Mhm.
to this.
Yeah, we're
MIT
developing the
guys.
technology in Alston, and we'll be working with a manufacturer in Madurai in southern India.
And they're going to do all your manufacturing or just your Asian manufacturing?
That remains to be seen. Right now, they're doing all the manufacturing.
Are you generating revenue already?
No, the product isn't ready yet. We're doing a field test in about a week and a half. In India, we'll test on between 500 and 600 patients.
Wow.
So we've tested in human patients in Boston and in Spain, and our next step is to do it on hundreds of people in India.
Does testing it in different areas affect the result of the test? Isn't an eye is an eye?
Yeah, I mean, ideally it wouldn't, but in practice you have different levels of training for the eye care provider. So we worked with optometry professors in Boston and highly trained optometrists in Spain. The next step is to work with a vision technician in India that has just a few years of training. And we'll learn about what the learning curve is to use the device, and that we expect that to be different than in Boston or in Madrid.
Wow. I still don't understand why you'd have to do the test in other places, but okay.
It's all about having, testing in the field in global health settings is different than testing in a nice clinic here in the developed world. And
Why not Africa?
that is one of the endpoints. Is we're thinking globally, and
Africa,
we're
China. Well,
yeah.
India goes to China,
Yeah,
right?
yeah. I mean, I think India was a nice first market because we have strong partners who are global leaders in eye care in low-resource settings there. There's a large need, and there was funding for us to kind of go there as a first market.
Does MIT help you at all? The relationship with the school?
Oh yeah, definitely.
Yeah.
So MIT and especially the MVision program were very supportive from the start. The fellowship that we met at provided a lot of resources for entrepreneurialism, for industry, not just academic, but also industry mentorship. And they really encouraged the fellows in the program to think about how they would commercialize the ideas that they're working on in academia.
And we also, MIT has a venture mentoring service, which is a service that basically tutors entrepreneurs in the school. And so we've been using that service regularly too. And so we get to interact with business mentors who have years of experience who basically guide us when we need help.
Nice.
Yeah.
Do you have a board of directors?
They are basically our board of directors right now in this venture mentoring
Yeah.
service, and they're really experienced and
They're
great.
acting as the informal
Yeah.
board of directors. We
You know,
don't-
I'm just wondering, that a business like this, if you get the demand you want out of India, is it going to be hard to scale it up for funding?
We hope not. Yeah, we don't really know yet, but we think India is a challenging market to start at. So we'll work out the kinks there, and if we can demonstrate that we're meeting this market need, then that will really pave the way to scale other places.